I have a patient for transfer to cardiology.
Did they have an acute coronary syndrome?
Yes, the troponin is 0.06 nanograms per milliliter.
Does the patient have chest pain?
No, the troponin is 0.06 nanograms per milliliter.
So, there are dynamic ECG changes?
No, the troponin is 0.06 nanograms per milliliter.
Why did the patient present to hospital?
The patient was crushed in a high-speed motor vehicle accident. The troponin is 0.06 nanograms per milliliter.
If I continue this conversation, I will have an acute coronary syndrome.
I can transfer you to cardiology. We have reviewed your proposal for the purchase of the new technology. It is comprehensive.
Thank you.
We have decided to reject it.
Why?
There was concern about the efficacy gain compared to standard therapy.
But I list the 30 randomized clinical trials, the 4 meta-analyses showing consistent superiority of the new technology.
Oh, the prohibitive cost was really the determining factor.
It is 5% more expensive than the current technology.
Oh, the cost-benefit was not explored in your submission.
Pages 100 to 150 in the document were devoted to cost-benefit, including a sensitivity analysis. This was prepared by an independent economic modeler.
Well, actually, we don't have any money.
What? I want to speak to your superior.
I don't actually work for the institution.
Why are you telling me this?
Your business manager approached me in the street. He pointed you out and gave me a badge and $20 to talk to you. We rehearsed the script. How did I do? By the way, by now he should have completed a sale of the assets of your department. Hello. You performed the autopsy on Mr. Smith?
Yes.
I am a lawyer for the accused. Do you mind if I ask you some questions?
No.
He was dead before you started the procedure.
Yes.
Did you check for a pulse?
No.
Did you check for breathing?
No.
Did you listen for heart sounds?
No.
You did not check for a pulse, check for breathing, or listen for heart sounds?
That's correct.
You did none of these things, and you still contend that Mr. Smith was dead.
Yes.
Well, what is your evidence, sir? What is your evidence?
His head was in a jar in another room. Hello.
Hello. We received your email suggesting the institution desist in its flogging of dead horses.
Yes.
Thank you for the feedback. However, we have a number of dead horse strategies in place.
Like what?
Purchase of a stronger whip,
But the horse is dead.
or changing riders.
But the horse is dead.
Well, we advocate saying things like, this is the way we have always ridden dead horses.
And people won't notice the horse is dead?
A committee can be appointed to study the dead horse.
To learn from our mistakes?
Even better, we can arrange site visits to see how other institutions ride their dead horses.
What?
We will increase the standard required to qualify as a dead horse rider.
But the horse is dead.
We will appoint a team of experts to revive the dead horse.
What?
If that fails, we will pass legislation declaring that the horse is not dead.
But it is dead.
We can blame the horse's parents.
I have a headache.
There are performance strategies as well, such as declaring no horse is too dead to beat.
Do you have an aspirin?
We will provide additional funding to increase the horse's performance.
I really need an aspirin.
We will do a cost-benefit analysis to see which riders get best performance for cost.
I think it may be a subarachnoid hemorrhage.
We will declare the horse is better, faster, and cheaper dead.
Please stop.
Actually, after considering all these strategies, we will be promoting the dead horse to a supervisory role.
Can it take your job?
Sad news about Jenkins.
Yes.
His myocardial perfusion study was normal. I guess it must have been cancer.
No.
An infectious disease?
No.
A rare congenital disorder or an inborn error of metabolism?
No.
It is such a complex situation. Were there any clues?
The 2 years of effort-related chest tightness relieved by rest and sublingual nitroglycerin, the 5 millimeters of ST depression in all his leads with the episode of chest pain that brought him into hospital, and the 1,000-fold change in his biomarkers were hints.
So, I guess we will never know for sure.
The autopsy showed near obliteration of his left main coronary artery by atheroma.
These things are so subjective and operator dependent.
What? Oh, yes, myocardial perfusion studies.
No, post-mortem examinations.
I guess. You will never know.
Thank you for calling the CEO Innovation Funding Hotline. This is an automated system using voice recognition. If your call is in relation to a submitted application, say submitted.
Submitted.
Please hold. Do you have your submission number?
Yes.
Please enter your number followed by the hash key. Your 10th submission for a functioning network desktop computer over 10 years has been received. Thank you. Is your call in relation to the status of your application?
Yes.
Please hold. The status of your application is submitted. Do you have any other questions?
Yes.
Please say the most relevant of the following: status, placatory statement, condescending lecture, human operator.
Human operator.
Please hold. You have chosen human operator. Unfortunately, this function is not available from this service. Please say the most relevant of the following: status, placatory statement, condescending lecture, human operator.
Placatory statement.
Please hold. The CEO takes your submission seriously. The process of evaluating your submission is rigorous. You can use this service to check for status updates. If you have feedback, please place it in the wall slot, labeled Shredder in the administrative section. There may be some noise with placement, but be assured your feedback will receive its due attention. Please hold while you are returned to the service menu. Please say the most relevant of the following: status, placatory statement, condescending lecture, human operator.
Human operator.
Haven't we been through this? This function is not available from this service. The automated system shutdown has commenced.
What?
This system was brought to you by the last round of innovation funding. Hello. Bye.
Hello. Thank you for consulting on Mr. Jones. What do you think?
He needs an MRI.
Of what?
The affected area.
The affected area I treat, or the affected area that you treat?
The affected area I treat.
Oh, what do you think is wrong with him?
It is possible that he has a disease of the affected area I treat.
What about blood tests?
Yes, disease that affect this area can derange blood tests.
I mean, what do you think his blood results mean?
I'd prefer to wait for the MRI. He is not claustrophobic, is he?
No.
I'll know more after the MRI.
Do you think his occupation as a metal grinder with recent penetrating eye injury, his past metal clipping of the subarachnoid aneurysm, his automatic implantable defibrillator, the orthopedic external fixation of all his four limbs, the pig iron nail that impaled his left leg, that they have been unable to remove, and his creatinine of 400 micromoles per liter, will be a problem?
Oh. Hello.
Hello.
Your new service funding application for $4 million capital cost and $2 million recurrent expenditure has been partially successful.
That's great.
You received an important fraction of your request.
50%.
Less than that?
25%.
Less.
10.
Less.
Well, how much?
You have received approval for purchase of an item from your capital expenditure, cost of up to, and including $1,000.
That is 0.025% of the capital expenditure cost.
As you accumulate assets, you can build a case for recurrent expenditure.
The cheapest item on the capital expenditure list is $2,000.
You all else get your choice of either a 2B or HB pencil.
What?
You appear somewhat disappointed.
Yes.
I can give you your pencil now.
Can I have a pacer?
No.
Can I have a sharpener?
No.
Oh.
The CEO has also authorized departmental cost-saving exercise. All A4 paper will be quartered to A6, immediately quadrupling paper stock.
But
all applications will continue to be 12-point, or the equivalent in pencil, and there will be a page limit. This will reduce the amount of ink and the amount of distracting technical detail so common in these documents.
the A4 paper will be quartered?
Yes. The CEO has authorized the purchase of state-of-the-art $100,000 paper cutting machine.
I'll have the 2B pencil.
The graphite of 2B is too soft and will smudge excessively on the A6 paper. So I will give you the HB.
Anyone got a sharpener?